There are three locations that are fairly standard for the placement of breast implants: the inframammary, or an incision under the breast, the periareolar or right at the edge of the areola, and the transaxillary, which is way up into the armpit. Each incision has certain advantages and disadvantages, and I think that we have to be very candid when we talk about these different options. The inframammary incision is a standard type of incision done by most people. The advantage is it's usually very discreet, it's well hidden in a standing position. There are theoretic advantages in terms of possibilities of contamination. So it's a decent approach. The disadvantage is it will show. If you're raising your arms after the surgery, that person standing in front of you will see the incision. If you're in a two-piece bathing suit and you're on the beach someplace, somebody will very likely going to see that scar, even if it's placed well. The periareolar incision is right at the edge of the areola. The advantage is it's an extremely discreet incision. It's placed right where the skin color changes. So it's a very subtle type of a location. And even if it's noticeable, most of the people who are going to see it are those who you want to see it. So it's not going to be visible to the average person standing by you. The disadvantage is that potentially you're going through some of the relatively contaminated tissue of the breast, and there has been some reports in the literature suggesting that this may increase the risk of capsular contracture. I think that the data is interesting and we have to consider it, but I'm not sure that it's overwhelming. The incision going through the armpit is probably the most discreet incision that we can possibly get. In time, it is nearly invisible. But the key is, how long is that time? In most cases, it looks okay right afterwards, and then it looks a little dark for about 6 months, and then sometime after that, it becomes essentially invisible. The disadvantage is that it has to be done extremely carefully by somebody who knows really what they're doing. I use an endoscopic approach, so I have complete visualization of all of the anatomy. Without that, you're kind of hoping to get a decent placement. So I think that the key to all of this is talk to your doctor. Make sure that you know what your options are. If you have the heebie-jeebies about one approach versus another, say it, because there are three main ways of doing this operation, and certainly you can get your desired result.